Hello everyone, this is Dr. Tushar Patel from IndusTV. On behalf of Indian Health Camp of New Jersey State AAPI, and national AAPI organizations, we have compiled this video of healthcare professionals who received their COVID vaccine, and they all wanted to give a loud and clear message to all citizens of the US to take the vaccine as soon as it is available to them. Please do not fall into any wrong and misleading information from anyone, as the vaccine was developed and approved based on the safety and efficacy and not politics. The vaccine is the only way we can leave the pandemic behind us. Until you receive your vaccine, and about 70 to 80% of our fellow Americans get their vaccine, we are not safe, and we must continue to take all the precautions we have been taking, such as facial coverings, avoid crowded places, safe social distancing, and hand hygiene practices. Together, we can make a big difference and win this war against invisible enemy. Let's hear from our colleagues from all over the USA, and thank you for your support.
Greetings. I'm Dr. Sudhakar Jonnalagadda, President, American Association of Physicians of Indian Origin, AAPI. Friends, please take vaccine. It not only helps you protect you and also helps to spread the infection to your friends and families. Personally, I took vaccination, my family took the vaccination. A lot of doctors from AAPI took the vaccination, they're doing fine. Believe in technology and science. Don't believe rumors. Please take vaccine. Thank you.
This is Dr. Binod Sinha, board certified urologist in Central New Jersey. I am the president of the New Jersey State AAPI. I took vaccination for COVID-19 2 weeks ago. I had no side effects, no pain in arm, no body ache, no fever, no chills. I will request all of you to get the vaccine for COVID-19 as soon as you can to prevent this disease from spread and getting sick. Thank you.
Okay guys, I'm getting my first dose of Moderna vaccine at St. Peter's University Hospital. Thanks to the hospital, and I encourage all of you to get this vaccination as your turn comes. This is the most vital step to beat this pandemic. Join me getting your vaccination. Thank you. And I'm done. All right, guys. Hello, friends. This is Dr. Bhavin Parikh. Happy holidays and Happy New Year. I work here in a multi-specialty hospital in Sacramento, California. We have been taking care of COVID patients since March of this year. It has been very challenging and tough year for all of us, but luckily now we have hope. I'm referring to recent approval of Pfizer and Moderna vaccines in prevention of COVID-19 infection. Healthcare workers throughout the United States have started receiving both vaccines. I got my first injection of Pfizer vaccine recently, and so far I have no side effects. My 40 to 50 physician friends have received both vaccines, and none of them have any side effects. So please do consider getting vaccine when it becomes available to you. Both of them are very effective and are overall very safe. If you have any questions or concern, you can talk to your primary care physician, and don't get distracted by fake information which might be there online. Please practice 3 W's, meaning wear a mask, watch your distance, and wash your hands. Thank you so much. Have a wonderful and happy 2021. Thank you.
Hello everyone. My name is Shridevi Shah, and I'm a practicing anesthesiologist at the Newark campus of Rutgers University. Being a frontline healthcare worker, I would like to urge all of you today to please take the vaccination as and when it gets offered to you. While the arrival of a vaccine is a good news, but it doesn't necessarily mean an immediate end to our worries. And so just as we have taken precautions so far, and the precautions that we have known have worked, like wearing a mask, hand hygiene, and physical distancing, this vaccination process also needs to be added to the to-do list. For everyone, in order to achieve better control against this deadly virus. I hope all of you take the vaccine. Thank you.
I'm Dr. Avinash Gupta, President of MOCAPI and a cardiologist. Being a frontline health worker, I was offered the vaccine, and at the first opportunity, I signed up and showed up today at my hospital where I was given the first shot. I was observed for 15 minutes and released. I told myself that I am not the first one to get the vaccine. The vaccine was already tried in 44,000 people in the Pfizer trial, and out of 44,000, 22,000 did get the vaccine and 22,000 got the placebo. Out of 22,000 getting the vaccine, only 8 people got COVID, whereas 22,000 people getting the placebo, 161 people got the COVID disease. That's where the 95% efficacy comes from. Not only that, they were observed for 2 months. Usually, the side effects happen in first 6 weeks. So FDA did have the safety data for 2 months, and usually there were soreness at the injection site and some fatigue, and they went away in 24 to 48 hours. So I went to my office and saw patients all day today. And when I came home in the evening, when I was taking a shower, when I touched here, then I suddenly realized that, I have a band-aid there. And when people started to ask me, do you have any side effects? Then I thought, okay, I do have some soreness. So I would recommend everybody to get the vaccine when it is made available to you. Save lives and save yourself, save your family. Thank you.
Dr. Parikh, Sanjiv Parikh, guess what I have for you? The biggest weapon to get over this pandemic. In this little syringe, a very small 0.3 ml of the vaccine can help us all win this battle. I had my vaccine today. So far I'm good. All my friends who had it last week, they're all doing well. Don't be afraid. Leave your mask on. Go for the shot.
Howdy folks, my name is Dr. Shah. I provide critical and medical care to our Kentuckians. For last 9 months, I have taken care of numerous COVID-19 pneumonias causing sepsis and death. Vaccination from Moderna or Pfizer remains a primary prevention for COVID pneumonia death. I would be getting my first dose of Moderna vaccine.
Ready, sir?
Yes.
Stick in.
I appreciate your help in stopping this pandemic. Have a great day.
Hello everyone, my name is Dr. Rajan Shah. I'm a practicing gastroenterologist at several New Jersey hospitals. I witnessed devastation caused by COVID-19 infection, losing one of my colleagues and seeing short-term and long-term disability in several colleagues and patients. I was offered first batch of vaccination when it became available, and I received COVID-19 vaccination, Moderna, on December 22nd. Let me share my experience with you. I was very much impressed with the organized system of vaccine delivery and side effect monitoring by a phone app called vSafe. I was observed 15 minutes after the vaccination for any immediate side effects. I experienced mild injection site pain and few muscle aches for 24 hours, relieved with Tylenol. Did not lose any time from work. Now let me tell you why I chose to receive vaccination in first place, with all the misinformation around. Number one, I know that the virus is everywhere. so many millions infected already. Virus is very contagious and virus is very deadly. Now, what are the ways we have to combat this virus? Number one is prevention. By using the masks, social distancing, hand washing, sanitizer, and avoiding gatherings. Number two, very important way to beef up your immunity and your defenses with vaccination. We are fortunate to have a very good vaccination within a short period of time, very effective in preventing infection in 95% of the cases. Treatment is not perfect, so my advice is to get the vaccination, keep the preventive measures, and keep.
Hi, I'm Dr. Pooja Patel, an internal medicine physician from New Jersey. I took my first COVID-19 shot the first day it was available at my hospital. Most of my colleagues just had some soreness lasting for less than 24 hours. Those who had COVID-19 before and took the shot had mild symptoms like headache, fatigue, but they all lasted for less than 24 to 48 hours. Vaccine saves lives. I believe in science. I took my shot. Do not be afraid to take your shot when it is available to you. Wear your face masks. Let us all work together towards making 2021 a healthy and safer new year. Happy New Year, everyone.
Hi, are you confused to take COVID-19 vaccine? Do you care for your family, friends, your community? I do care. I'm a general dentist. I'm a Dr. Priti Shah. I got my vaccine and next day I was working with my patient with confidence, without fear. Please, I strongly recommend to take vaccine. There is no side effect of the vaccine and you will show the community, your family, your friends, you care for them. Please do take the vaccine. I strongly recommend to get the vaccine. All of you, good luck.
Hi, I am Shankar Iyer, practicing in the state of New Jersey. This pandemic, as you know, has really caused tremendous turmoil for all of us. Thanks to the introduction of the vaccine, now we can feel much safer and live healthier. I just got mine 2 weeks ago and I can't wait to get my second dose next week. I urge all of you to participate in this vaccination program and get the vaccine inoculated as soon as it's available in your area. We have no other choice but to follow science and to keep ourselves healthy. Be safe, act well, and act smarter. Take the vaccine now.
Hello everyone, this is Varsha Singh. I'm a neuroscience nurse practitioner and a healthcare provider. I have educated community about many conditions and today I'm asking and requesting that consider taking COVID-19 vaccine. Many healthcare providers like me have taken it. You should consider taking it as well. COVID-19 vaccine is considered to be providing protection against the severe symptoms of COVID-19. So take that action when your opportunity arrives. Consider taking COVID-19 vaccine. Thank you.
My name is Dr. Tikal Kansara and I'm a resident internal medicine physician at Metropolitan Hospital, which is a part of New York Medical College. I want to show you something. This is my vaccine card. I got my first dose of COVID-19 vaccine on December 22nd and I'm almost due for my second dose. All my colleagues as well as the hospital staff where I work and my friends and family members who work in hospitals across the United States took the vaccine. And let me tell you, I know of no one who has any side effects from the vaccine. Now the question you might come across is, the vaccine was hastily approved. Is it effective? So let's clear some myth about the vaccine. Like any other medicine or a vaccine, the Pfizer or Moderna vaccine, which is currently available in the United States, went through the same 3 clinical trials, rigorous screening process by independent clinicians, vaccine serologists, biologists, and immunologists before being approved by the FDA. The Pfizer vaccine was studied on around 45,000 participants and Moderna vaccine on around 30,000 participants. And these trials showed an efficacy of around 94 to 95%. So yes, the vaccine is effective. The second question is the vaccine safe? Now, according to FDA analysis of data, there are 4 grades of side effects, where 1 being mild and 4 being serious. We don't have to worry about grade 1 to 3 side effects as they are mild to moderate. There are reported incidents of local reaction at the site of injection like pain, redness, swelling, as well as in cases of fatigue, headache, and fever. The serious side effects or the grade 4 side effects occurred in 0 to 0.1% of the cases only, and they occurred equally whether the participants took the vaccine or the placebo or the blank shot. So we cannot say with certainty that the side effects are related to the vaccine. I urge you to help yourself, your friends, and family members by taking the shot of COVID-19 vaccine. It is the only ray of hope we have currently to prevent 2021 from being a new 2020. Thank you.
Hi everyone, my name is Dr. Ninad Desai and I'm an emergency room doctor. I received the first dose of my Pfizer vaccine on December 16, 2020. Along with the chairman of the ED, we were the first ones to receive the vaccine in our hospital in Bushwick, Brooklyn, New York. I believe in the vaccine and I also believe in the science behind the vaccine. I got the vaccine because not only do I want to protect myself, I also want to protect the most vulnerable in our society, such as my grandmother. I urge you all to get the vaccine as soon as it is available to you so that we can spend time with, hug, and kiss our loved ones again, so that we can start spending time outside and resume our businesses and live a life without fear. If you have any questions, please do not hesitate to reach out to me or contact your doctor. Have a happy and a safe new year, and please wear a mask.